to learn already. Okay, so here we go. So it's a 7 years old boy is brought to the office due to the persistent bedwetting. So he had been bedwetting since 3 years, since age 3. He has been able to stay dry during the day but continues to have accidents at night. The child drinks fluid primarily in the morning and early afternoon and does not drink juice or a caffeinated beverage. For the past 4 months, his parents have tried anaerosis alarms, that's help, and awarded gold star for dry nights without improvement of the frequency of bedwetting. His parents are frustrated, and the patient is sad about missing activities such as summer camp. He was recently invited for a sleepover party, but he's nervous about wetting the bed, so he probably don't want to go to stay with his friends. So he was otherwise being in good health. Has met all other developmental milestones and take no medications. Remember, he's 7 years old. Physical examination, urinalysis are normal. Um, which of the follows the best next step in the management of the patient? So you guys can see the answer here. It is desmopressin. Desmopressin. I pick imipramine, but later learn that imipramine can be used too. But it's let's read it. So it's kind of combined with the desmopressin. So the guy, this little patient, have is a primary nocturnal anaerosis. Primary nocturnal anaerosis. Okay, primary nocturnal anaerosis. Okay, coming back in a second. Primary nocturnal anaerosis. So the definition is nighttime urinary incontinence in the age of less than, more than 5 years old. Okay, no prior prolonged period of overnight dryness. So, primary nocturnal anaerosis. Primary nocturnal anaerosis. Pathogenesis, it is delayed maturation, delayed maturation of the bladder control. Okay, so is more frequently at nocturnal urinary output. Uh, Augmentation of the nocturnal urinary output, for example, evening fluids. But, the pathogenesis is like if the patients drink a lot of fluids after before going to bed, or if you have a lower ADH or diminution of bladder capacity. Okay, in this case, the diminution of the bladder capacity is when you have like a lot of constipation and low pressure over the bladder. That's one of the causes too. Risk factors: family history, boy age of 5 to 8. Evaluation is urinalysis. You had to find out there's not a urinary infection or any other complication, and avoiding the dairy. So the management is treatment of comorbid conditions. I have, by example, constipation, behavioral modifications like restrict evening fluids. Okay, Anaerosis alarm. We can put an anaerosis alarm, but he used this before and it was failed before. And the last is desmopressin. So the questions is asking is about the management. So the last resource, desmopressin. desmopressin. I was thinking about when I was reading this vignette, I was thinking they're gonna ask me about the Anaerosis alarm because I have seen questions asking the same thing before Anaerosis alarm, but they ask you about a little more because they tell you that patients used to have Anaerosis alarm before, so that won't be the answer. So is desmopressin. So let's see how desmopressin works. So primary nocturnal anorexis is defined by urinary incontinence in children aged over 5 who have never achieved nighttime dryness and have no underlying medical condition explaining anorexis. Boys with a family history of delayed bladder control are predisposed to prolonged bedwetting. Coming back. So, through Anaerosis has a high rate of spontaneous evolution over time. Many families seek active intervention to improve quality of life due to embarrassment or anxiety. The initial step is the management include behavioral modifications such as avoiding before bedtime and minimizing the fluids intake before going to bed. For children who do not respond to lifestyle change, Anorexis alarm are the most effective long-term interventions, but can take 3 or 4 months to be effective. Pharmacotherapy with the desmopressin is also considered the first-line treatment for those who desire immediately improvement. Okay, desmopressin. Oral desmopressin, an antineurotic hormone analog to decrease urine production during sleep. Okay, let me go to get the baby. Patients should be considering a minimalizing fluid intake in the evening to prevent hyponatremia with therapy. In addition, the rate of relapse on discontinuation of desmopressin is high. So it's safe. If you stop the desmopressin, you can relapse. So you can start wetting the bed again. So the other options is I picked this one, imipremine. Tricyclic antidepressant imipremine are as effective as desmopressin. Okay. However, they are reserved for patients who do not respond to desmopressin due to the rare but serious side effect. So they're talking about the side effect of imipremine, that is increased suicidality and cardiotoxicity. So imipremine can produce increased suicidality, thoughts, and cardiotoxicity. So let's read that again. Tricyclic antidepressant, by example, imipremine, are as effective as desmopressin. However, they are reserved to patients who do not respond to desmopressin due to their rare but serious side effect. Okay. You can guys read the oldest one. Okay. Let me make a pause here. I'm coming right back with we can